you went on the carnivore. Well, I don't like using the word diet either, but on the carnivore sort of way of eating. How was that experience for you? And what kind of an effect did it have on your blood sugars?
Yeah, so the carnivore way of eating, from a blood sugar standpoint, is probably the best blood sugar control one can get. When you are eating essentially no carbohydrates and you're eating protein and fat, in their natural forms only, that basically it's the most boring CGM you'll ever see. It's like a flat line, and you can't even tell. Like if I don't label, what time I ate, no one would even be able to tell. There's some, minor little bumps here and there. A lot of times I get more of a blood sugar effect from exercise, like you said, than I do from when I eat. Or other stressors in my life. I'll see, if I'm doing a difficult surgery or I'm, giving a lecture, I'll see my blood sugar go up a lot more than it does when I eat. So carnivore from a blood sugar control standpoint is really unmatched, as far as I'm concerned. The thing that I found most beneficial about carnivore, over the other sort of low carb, strategies, is it just is simple. There's nothing to count. There's nothing to, track. I'm not worried about, I'm just eating, those foods that fall within carnivore. And I just found it easy. The shopping is easy. The cooking is easy. It's just, I worry, I didn't have to think about food at all when doing carnivore. I don't have to think about food. So for the past 2.5 years or so, I've been primarily carnivore. It's what works for me. But again, it's not, I don't tell all my patients you should go carnivore. I put it out there as an option. And like I said in my book and in my practice when I'm talking with people, I say, these are, you can eat any food you want as long as it's going to support your metabolic health in the end. And, we'll find the strategy that works for you in particular. But for me, I have found carnivore to be the most helpful, the most sustainable. Like I said, I've now been, over 2.5 years on it, and I don't see any reason to stop because it's
It's
doing what
working
I
for
need.
you.
It's working for me exactly.
I know, but it's not as restrictive as people think, is it?
No, it's really
Uh,
not. So I eat a wide variety of meats. So that's beef and lamb and pork and chicken. I eat seafood, a wide variety of seafood. I eat eggs, I eat dairy, so yogurt and dairy. And so, it really isn't that restrictive. And, people actually get very creative with carnivore. There's all sorts of, you would think like, why do you need a cookbook for carnivore? But there are all sorts of carnivore cookbooks out there that you can make, just about anything you want, as a carnivore. But in the end, like I said, I find it just very simple. The shopping is simple, the preparation is simple, and it also keeps me less hungry less often, which is one of the other things I said that is good for metabolic health. So for the most part, I eat once or twice a day, and again, I don't do that because I'm restricting myself. I do that because I'm only hungry once or twice a day.
um, yeah, that's interesting. I mean, even for type 1s, the carnivore diet is probably the only diet that would ensure those flat flat lines, because it's difficult for a type 1 to get those flat lines, to make sure you're getting enough insulin throughout the day, but you're not having any highs and lows. But the carnivore diet is very helpful for type 1s as well. So if any